Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Sandy Saggar. He's interim CEO at Connexall. Welcome, Sandy.
Thank you so much, John.
Yeah, excited for today's discussion. But before we dive in, tell us a little bit about yourself and Connexall.
Absolutely. So I've worked in multiple health systems as a CIO and had the opportunity to see Connexall in action. We had a connected hospital environment, and when the opportunity presented itself a few years ago, I joined the organization to help lead us into the future. And over the last 3 years, worked with Connexall to enhance the connected hospital experience for all of our customers out there.
That's awesome. I always love working with recovering CIOs, as a lot of people call themselves. And so I think you have an interesting perspective. How should these healthcare leaders stay focused on maybe the short-term or the near-term initiatives that we know are going to impact, clinical care, the quality of the care, even the operational financial goals, when there's so many shiny objects all around us here?
Yeah, that's a great question. This is the cycle we move through, right? In health tech or in tech in general, where there's always the next shiny object coming through, and so we all turn our attention to that. But as a recovering CIO, I would say that one of the things I learned along the way is to be a realist, right? What can we do today that's directly going to influence patient care, the frontline caregivers? And so that we've done a lot in the last couple of decades around moving the needle with respect to healthcare IT. And we have a lot to optimize. We have a lot to go back to say, we put a lot of systems in, we put a lot of medical devices in, but we're not getting the true full value out of those systems. We're not helping the staff and the clinicians to improve their workflows. So we also need to take a pause. Gen AI and where it's going, we obviously can't ignore that.
Sure.
But it's time to pause and also go back and improve.
I mean, to your point though, how should a healthcare organization balance kind of leveraging all the technology that they have implemented and even the infrastructure with these new solutions?
Yeah, existing investments are key, right? We don't want to keep replacing what we have. Sure. Dollars are tight, and we have to focus on our budget. So certainly extracting that full value out of those investments, that's where I'm happy to say solution providers like Connexall can come in and help extract existing investments and say, let's extract the full value of what you've already put in place and then enhance that in terms of what's the critical events, what are the critical alarms, what's critical information that needs to be extracted and shared with providers.
What are some examples of that where Connexall goes in and helps organizations maximize their already existing investments? Are there some commonalities you see between your customers that you're like, oh, we are really good at these areas?
Yeah, absolutely. So, falls risk is a good example, right? A lot of organizations working around falls.
Yep.
And they have some solutions in place, and other organizations have different solutions in place. So whether you have smart beds, RTLS, nurse call systems, you have fall risk scores coming from the EMR, you have telesitters, there's lots of technologies out there. And what we do is we bring those together to enhance preventing those falls for patients. So, the more technology you have, are you leveraging that to its fullest capability? So let's make sure that the fall risk score gets pulled in from the EMR, the smart bed. If someone's coming out of the smart bed and they have dementia or some other condition, that those things get married up with the location of the clinician so that they can react to that scenario immediately and the closest responder to that scenario. So we can leverage all those existing systems and investments made with health systems and react faster to those types of scenarios.
Interesting. And is this about kind of bringing together the data from all these systems? so that there's like a single dashboard, or is it about combining the data to do something else interesting?
Yeah, it's a combination of both, really.
Okay.
So what's actionable today? What do we need to do today immediately in that scenario I just described around patient at risk of falls? Jumping in, getting the clinician to respond to that to prevent that fall. But then how do we use that data later on in terms of analytics and ultimately AI, and saying maybe we can actually push the bed exit up, right? And prevent that from going down in certain scenarios. Or maybe we need to send information back to the room to a digital assistant to start talking to the patient before the nurse gets there. So it's a combination of what we can do immediately and then what we can do with the data in the long run.
Yeah. Well, and talking about this, it sounds like you have a very open system that embraces all sorts of technologies. It's one of these tried and true questions. I think this whole series is about tried and true tech nerd questions that I like. But how do you see that kind of vendor neutral position, which I think is what you guys take, versus the closed ecosystem? There's pros and cons to each, right? But how do you see that playing out in healthcare?
Yeah, we've been opening up. We need to open up more. There's still a lot of silos. Being a vendor neutral organization allows us to grow, right, with health systems. Sure. As your systems may change, as they might get replaced, you don't have to worry about that. We're still going to grow with you.
As you acquire a new one that has other technology.
There's a lot of M&A happening, right? As you acquire new health systems, new hospital sites, we can help take that noise, that technical noise out, and help with the integration there. So really, we've been doing this for 25 years as an open system, as a system that's open and interoperable. And we truly believe, with all the pros and cons out there, that that's the way to go.
Interesting. So another age-old question that I think would be interesting to hear what you think is kind of this balance between, a hospital comes to you and says, oh, can you just implement something of value? Like out of the box, I just want it to work, right?
Right.
Versus, of course, they also want it infinitely customizable because Dr. A likes it this way and Dr. B likes it that way.
Right.
Like, how do you, how does Connexall kind of approach this? We want to be really useful, when you implement Connexall, but also allow you to customize it to your workflow.
I love the age-old questions. Those are, that's what we keep asking them over and over again.
Well,
right?
And the older I get, the more I ask it.
We just like to use the word old.
Yeah.
Connexall's take an approach where we have standard protocols, communications between any of the medical devices and systems that input into Connexall, and then an output from a mobile device or mobile app perspective. So we do standardize there, but we also have the ability to meet the local needs. Every hospital system has their own local nuances that we have to work through.
For sure.
So we have created modules to allow for those local needs, and so that we can essentially, marry up with the workflows and the technologies that those health systems have.
Interesting. And you work with a lot of hospitals to kind of connect all these systems. What do you think it really takes to create that kind of connected hospital experience that does provide both clinical best practices or other goals that you may work with them on, Joint Commission? How do you see it? What does it take to really create that connected experience?
Well, one of the biggest, successes we've had is when we have new hospital environments being built. So these could be new towers, these could be brand new greenfield hospitals, because that's an opportunity for a health system to actually take a step back and say, I'm not constrained by my physical environment. I may be less constrained with my budget because I have more dollars at hand for technologies that I want to put in place to meet the needs of those workflows for those clinicians. So, and we're able to create the connected hospital environment in a more successful manner there, because we take all the use cases that are out there to solve all those problems that need to be solved at the front line, and we're able to do it in one fellow swoop. Now, it takes a long time to do that in terms of the build and construction of those facilities, but we're truly able to create that connected hospital experience. And then when health systems see that, they start to take those ideas and bring them back and retro those to other facilities, because they see the value. They see the value of the connected hospital experience.
Yeah. Seems like the other area that's, another age-old question, at least at this event, is burnout.
Right.
Like and the discussion of some burnout and the fatigue that people are feeling. And one of those is around alarms, right? And the safety and workflow around those. How do you guys look at that? Because it sounds like you're connecting all of those, and but you can also produce a lot of alarms, right? So what are you doing to kind of reduce that overload, the fatigue, the burnout that people are feeling from all of these connected devices?
Right. No, it's a real problem. The Joint Commission has had alarm fatigue or alarm safety, on the docket for over 10 years.
Yeah.
And with all the systems that help, all the IT systems have been put in place by hospitals, this continues to be a growing problem. I'm excited to share that we've announced the introduction of our Clinical Elevate program, which is really a structured way for us to work with hospital systems, work with their clinical teams, pull the data through our analytics team, and work through the process of right-sizing the right information going to the right caregiver at the right time, and really hitting the heart of alarm fatigue and that burnout. Because all the noises, all the information overload that's happening at the front line, we really need to tackle that now. That's really the next frontier. And I would say we haven't made the movement that we should be making. So I'm really proud that we're formalizing this program. We've been doing it for 25 years. But we're really formalizing the program so we can hit the heart of that problem and tackle it.
Very interesting. What do you see as next for Connexall? What do you see next down the road? Obviously, it sounds like more connections, more streamlining. What else do you see in the future?
Absolutely. So lots of new technologies, autonomous robots, digital assistants, Gen AI. So we're certainly keeping on the cusp of all of these things and how we can make it, as I said before, I'm a realist. How do we make those things real? Not technology for technology's sake, but what are the use cases that will solve those problems, whether it's food delivery or medication delivery through autonomous robots, whether it's having digital assistants and prompting them to talk to the patients in a proactive manner. So those emerging technologies are there. Other frontiers, if you will, expanding what we do from the hospital environment more in the home care realm, because we have the same thing that we're going to deal with from a home care perspective. A slew of devices, a slew of technologies. How do we bring those together as Connexall does and make sure that we're caring for those patients effectively?
That's awesome. Sandy, it was fun talking about some of these important age-old questions that never go away because they are challenging questions to navigate. I appreciate you offering some insights and perspectives. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks, Sandy.
Thank you so much.